Well, thank you, Paula. Thank you to all of our panelists. And I just want to dive right in because we have a lot to discuss. And Alexis, I want to start with you, not just because you're on my right, but because we've spoken so much today, appropriately, given kind of where we physically are in Little Rock and in Arkansas, and kind of where we are in a kind of larger sense in our country about kind of the loss of kind of reproductive freedoms and rights and kind of self-agency and autonomy. And I just want to give you the opportunity, as the head of Planned Parenthood, to kind of fill in any gaps that you think there may be to what we've already talked about yesterday and today, and also to share kind of what you're doing at Planned Parenthood to try to still ensure that kind of every woman everywhere can access the care that we need at any moment of our lives.
Yeah, absolutely. Well, first, thank you so much. It is an incredible honor to be here. It's incredible just to be among women's voices and powerful women's voices, because we've lost the constitutional right to abortion, but we haven't lost our autonomy, right? We haven't lost our full freedom, our agency to fight back. And I think that is actually the thing that I've been holding very dearly over the last, few devastating months. The only thing I would add to what has already been said here is just the journey of the patient. We know over the last year, because of SB 8, yesterday was actually the anniversary of the oral arguments for Dobbs, but before that, we had SB 8 in Texas. We know that on average, patients are traveling over 400 miles one way to get access to care. It means that they are leaving the end of a work shift, that they are putting their kids in the car, because as someone, I think Maria Teresa said, they're more likely to be moms already. They are thinking about their elder care, and they are driving long, lonely journeys because they are afraid to tell anybody about what is happening for fear of not just the criminalization of abortion, but also all of the other ways in which people have tried to shame and stigmatize and put fear in patients seeking access. The aiding and abetting laws, the travel across state line laws that people have been introducing, right? They haven't, been put in effect, but people hear that and they worry. And so what we are seeing is, in fact, a public health care crisis. We are seeing a mental healthcare crisis because of the impact of the journey. And it's not just on patients, it's also on providers who've been trained to provide care, who are literally reaching in their desks to offer snacks to the patients across them that they can no longer care. And it's also created an impact on trust inside of the healthcare system, which I think is also one of the devastating consequences. So, what we are seeing is obviously devastating from the patients. From a Planned Parenthood perspective, our first mission is to build that patchwork of ability. I call it like building the kayak of healthcare, literally abortion care, helping people get to where they need to go, helping providers get to surge sites where they need to be. But it really is on a much bigger level to really think about what does it mean to fight back state by state. What will it mean for us not just to have not 5 states? We forget Kansas. Kansas led the way in this summer, but states where we are going to have to identify different strategies to push back. And I think that hope of where people really are, and that they are truly, truly with us. There is no state in the union where banning abortion is popular. We just have a systematic kind of gerrymandering and capture of courts and other ways in which we have been denied access. But I do think that as the theme has been today, abortion and democracy are so interlinked. And in some ways, while I'm happy for the young people definitely saved democracy, but abortion saved democracy too, and it will, because we will continue to fight state by state.
MK, Alexis spoke about how now in many states women are driving an average of 400 miles, which means there are many women driving far further to be able to access care. And she used the metaphor kind of also of a kayak. Both that reality and that metaphorical description are appropriately kind of applied, I think, to your home state of Illinois, given that Illinois is now surrounded by states that have grossly limited or eliminated women and girls from being able to access abortion care. And so I wonder if you could talk about kind of what the governor and all of his allies, most importantly you, among them are doing to try to help protect kind of patient access and public health in Illinois, and also help protect patient access and public health in your surrounding states. I mean, your husband didn't run to be kind of the governor of the upper Midwest for women who need healthcare, but now he is that person, supported thankfully by you and so many others. So, how is he and the larger you kind of navigating those different priorities?
Well, let me first say it's so great to be here and honored to be here with such a wonderful group of great women and men. So my husband decided to run for governor when the unfortunate Donald Trump was elected. And choice was at the top of his list of one of the reasons why he wanted to run. And, we could clearly see what was going to happen. And fortunately, he was elected, and in 2019, he got right to work, and he enshrined in legislation women's reproductive rights in Illinois. So every woman has a right to their reproductive health and a right to an abortion in our state. That was first and foremost, and he got that done very quickly. So we are an island in the Midwest, and our healthcare systems have been, demand on them has been increased at about 30%. So my husband has worked tirelessly to support Planned Parenthood, who's such a great partner in Illinois, to help these women in surrounding states. In fact, they come from even further, from Arizona, Texas, from all over to Illinois. He's working on expanding Title X funding. He is working this legislative session to provide funding for more nurse practitioners to provide these services for women. And he's also backing new laws that will help healthcare providers have protection legally for providing these services, which is so important because other states are now threatening to sue providers in our state for providing services to women from out of state. So this is very important.
Thank you, and please thank the governor for helping to support women who voted for him, those who didn't vote for him, and those who couldn't vote for him because they live in surrounding states or further afield, but now are very grateful that he is in his seat. Dr. St. John, we know that kind of while, of course, abortion access and reproductive health are important to all of us, vital, kind of in the most fundamental sense to all of us, other issues affect women too. I think not only about what we've already discussed here today, access to paid leave, kind of employment protection while pregnant, gun violence, but also climate change. And I know that you, kind of in your home country and also really across the region, particularly given your kind of leadership at kind of the Caribbean kind of public health organization, have thought a lot about climate change and how it affects disproportionately women and girls. So I wonder if you could share a bit about your work and kind of what you're doing to try to center women and girls in the conversations around climate change, the work of climate change, and the mitigation of climate change's effects.
So the Caribbean is Hurricane Ali. And because of climate change, it's not just hurricanes anymore, it's severe weather events, floods, landslides, and drought. So climate change and health, people don't usually think about that as a marriage, but it's a very strong marriage. And for women who have to nurture families, keep communities together, they're the socializers of communities and the bearers of culture. When you have a hurricane or severe weather event, and sometimes drought as well, in the same year, every year, it's difficult to maintain the integrity of that family. It's difficult to maintain and put aside something so that there is wealth and legacy that goes on. In the Caribbean, and through the Caribbean Public Health Agency in collaboration with the Pan American Health Organization with the support of the European Union. We have been working on upskilling persons, mainly in the health field, on what it means to mitigate against, but also to understand what are the things that are going to be taken away by the effects of climate change. And so the University of the West Indies is one of the places where we're doing that empowerment. We have the climate change and health program so that there are persons in all of the different countries who can speak and understand and unpack. We're also in the Caribbean Public Health Agency ensuring that there's the evidence and the literature, and this is again in collaboration with University of the West Indies. We're documenting what are the effects and impacts, something as simple as the sargassum seaweed that is floating through the sea. And we're also working real time, and this is in collaboration with the Caribbean Institute of Meteorology and Hydrology and PAHO and CARFA. We do a forecast of the weather for every quarter and what are the health impacts expected. If it's UV light and the impacts on skin cancer, if it is dust, Sahara dust, and the effects on persons with respiratory disease. So we have the real-time effects being translated, as well as getting the evidence of climate change and health. Women and girls have to do a lot of that explaining and unpacking. And at the COP, we got a clause about loss and damage. So it isn't just the issue of the health perspectives, but if the economy is undermined by climate change, there isn't the money to deal with health. There isn't the money to move the health facility because it's too near to the coast. So women and girls have to be the explainers, the educators, the implementers, and the advocates to ensure that climate change doesn't overwhelm us.
Thank you. And Dr. Cooker, you're an expert on women's mental health. And I wonder if you could just reflect on kind of what you've heard, not only in this panel, but really kind of throughout the day so far, of all that is weighing on women. Weighing on women as we kind of think about our lives as working moms, or that we may be forced to become mothers when we don't want to be, weighing on women, either worried about sending our children to school because of the threat of gun violence, or young women who are going to school with the threat of gun violence. I live in a state where the state mandates that active shooter drills start in preschool. Worried about kind of climate change, as Dr. St. John was just talking about. Like, how is all of this manifesting in your work? And kind of what do you want us to know about kind of what you've observed kind of clinically, and what has shifted in recent years?
Yeah, thank you so much. Thank you for having me here. I think one thing that I've been struck by, not only at work, but even during this conference, is one word that I think is a common thread throughout all of this, and it's trauma. That women have experienced trauma for generations upon generations, and it is continuing today with the Dobbs decision, with climate change, with all of these things. And for so long, trauma was neglected. The idea was brushed away. Women were invalidated, told to just suck it up and move on with your lives. But we know that women are more likely to be victims of emotional abuse, sexual trauma, victimizations at work with sexual harassment. You saw the Me Too movement. And I know a lot of these women in this room have experienced trauma. And what I'm thankful for is a good level of resilience amongst a lot of women who've experienced trauma and use that to activate them. However, there's a lot of women who continue to live in trauma every single day and struggle with mental illness and don't have the same capacity to activate. And so I'm very fortunate to see those women on a daily basis and talk to them and hopefully be a validating source in their life. But I think we have to do a better job of supporting our communities, supporting our women who are being traumatized on a daily basis, whether that's interpersonal violence, trauma at work with sexual harassment, rape, as we've mentioned. We have to do a better job of getting these women the resources and recognizing that trauma has lasting impacts on your physical and mental health. And we still don't know a lot about that in the medical field, and how to best treat it and how to best support these women.
Thank you. Alexis, I wonder if you would pick up and segue from that, and how kind of the work of Planned Parenthood, I know now has expanded to try to help support women who have suffered trauma, support kind of women's kind of mental and emotional health, and of course your male patients as well. But kind of how has Planned Parenthood tried to, and not even more than tried, begun to respond to what Dr. Coker is sharing?
Yeah, absolutely. I mean, one of the things that we have seen as, one of the largest providers of not just sexual and reproductive health care, but being firmly centered as part of the public health infrastructure, is the need to tie together all of the needs and the services that, that are needed in communities. So people may come to us for access to birth control, people may come to us for access to abortion, but we are also providing mental health care and behavioral health care in many places. In Los Angeles, for example, we have our Planned Parenthood Los Angeles has a partnership inside of high schools, well-being centers, where there are Planned Parenthood health centers. Somebody can leave their algebra class, they can go and they can get, talk to a nurse practitioner about birth control, and then they can go next door and there will be a mental health provider, and then there will be a behavioral health provider. And when the kids are not in school, the parents in the community can come in and have conversations with those same practitioners and providers. That is an effort to be a much more holistic provider, a way to leverage not just the resources that Planned Parenthood can offer through many supporters, but also how to create incredible partnerships with states, with cities, with county governments in ways that really demonstrate how to take care of folks in that way. And I think that need has become even more important, obviously, in the last couple of years, going through the COVID pandemic, seeing the incredible disparity, the racial disparity in particular, seeing the people who are most impacted, who are living at the margins, not just at the healthcare system, but also at the education system and the transportation system. So literally meeting people where they are in their as they go to school becomes an incredibly empowered way. And I'll just say quickly, I went to observe kind of the opening of the clinic, and I got to see these young students taking the tour and hearing the all that was going on, and the nurse explained, you can ask me anything you want. I can tell you anything you need to know. And by the way, legally, it will be taken care of by Medi-Cal, and I legally can't tell your parent. And there was a light bulb that went off of agency, of empowerment, of a sense of my body truly is my own. We talk about it in the context of abortion rights, which is absolutely true. Bodily autonomy is everything. But every time someone is walking through a door of a health center, every time someone is going online looking for information about how to take care of themselves, that is an awakening. That is a moment of building agency. And so seeing that also in response, coming alive in response to what we know we need to address around trauma and other forms of healthcare disparity, I think it's just been really powerful to see.
MK, we know that a group that has a disproportionate amount of trauma in an already deeply traumatized country, are people who are in incarcerated settings. And we know that women are the fastest growing population in incarcerated settings. I should acknowledge my bias that I think we over-incarcerate in our country to a horrifying extent, and we incarcerate people for things that there are better, more humane, but also more effective pathways than putting people in prison. However, we do have an enormous number of people in prison, including an enormous number of women, many of whom have not actually had access to their constitutional right to health care. Incarcerated people are one of the only groups in our country that actually have an established right to healthcare in our country. And I know that this is an issue that is really close to your heart and important to you, in Illinois, and one that I am particularly grateful for, because I think there is so much discomfort, because I think that so many people know on a deep, visceral level that we do over-incarcerate in our country by many orders of magnitude, that discomfort then is kind of the escape hatch that people jump through to then not have to think about the tens of thousands of kids that we incarcerate in this country, or the more than 1 million people who we incarcerate on a given year. And so I am really grateful that you do not kind of jump into the escape hatch of discomfort, and that you really have kind of put yourself forward and are using your platform to try to not only advocate, but deliver the healthcare that any woman deserves, including women who are incarcerated. Can you talk about why you're doing this work and kind of what that work looks like?
Sure. So before my husband was elected governor, I had started to kind of dive into this work through our family foundation, where I was a director. And I was just starting to scratch the surface of this issue. And when JV was elected, I decided the first thing I was going to do, literally a few days after he was sworn in as governor, I went into the women's prison in Illinois. And the most important thing I did is I sat and I listened. I listened to these women, and I kept going back. I've been back many times. I'm going back again, and some of these women, we've become friends. And we have very private conversations where we ask the prison officials to leave us alone in a room, and they tell me what is going on in there. They've told me their stories, some of them deeply, deeply personal. And here are some of the things that I've discovered. 98% of women that are incarcerated in our state have suffered abuse, gender abuse, and other types of abuse. 80% of them are mothers. 86% of them are incarcerated for nonviolent crimes. So one of the first things that my husband and I decided to do actively was to reduce the women that are incarcerated in our state by 50%, and I'm happy to say we've done that today. Thank you. The other thing I noticed when I went in there were no women in the leadership of the prison structure that were lording over these women. So the women in the prison felt that the abuse that they suffered, it was just continuing in prison. It was just a continuation of the abuse they've suffered, in their lives. It was just horrible. So my husband and at my urging, we now have, well, there's the threat of smothering, with the pillow at night if you don't do this. I'm just kidding. We have a women's division warden, and I'm pushing to put that on the level of the director of the DOC in our state, that the women's representative is at the same managerial level as the director of incarcerations in our state. Women have to be treated differently in prison than men, and this is very important because there's not a lot of correction in the Department of Corrections. I'm also working with state agencies to provide housing for women when they get released from prison so they can reunite with their families. This was something else that wasn't being done in our state. You have to bring all the agencies together and have a round table and find out, how can we work together to provide the services that these women need? They need supportive services when they get out to reunite with their families and to get their life back on track. The other very simple thing that I discovered, and I think this is a problem across the United States, it's very hard for these women to get an ID. Anyone returning from prison to get an ID, something so simple that we all take for granted. They can't get a library card, they can't get a job, they can't rent, they can't open a bank account without an ID. And many of these people have no access to this when they're in prison. So we worked with the Secretary of State's office, and we figured out a way to do this online so everybody leaves incarceration with an ID in hand, which is very, very important. Thank you. We are also enrolling everyone that is eligible in SNAP benefits and Medicaid, and to get them off on the right foot when they leave so that they're taken care of. A lot of these folks suffer mental health issues and need their medication. And once they're released from prison, they have no access to these medications, and then they revert back into a very terrible state of health. So it's very, very important to make sure that we enroll this population and get them on the right track with the supportive services that they need. So I really hope that this becomes a model in the United States. We really need to reduce our prison population. These women are the most vulnerable, voiceless, powerless group of women in our country, and I really feel an obligation in my role to stand up for them and to fight for them, because they have nobody else doing this, and we all need to just band together and help this population. I feel really strongly about it.
Thank you, MK. I think you can tell by the number of times people applauded that there's a wide agreement and support for what you're doing, and also support for making kind of what you have proven to be possible in Illinois to be a model for the rest of the country. Because, you know, I know that your husband was just reelected to his second term. All of that happened in his first term. I think that's really important to acknowledge and even underscore. This did not take decades. So just thank you for your leadership and for proving what's possible when there's a sense of urgency to match kind of the urgency of the question. And Dr. Coker, you just have been nodding so much while MK was speaking that, forgive me, Dr. St. John, but I'm just skipping over you only because she nodded with such vehemence and frequency that I feel like she may have something to say.
Yeah, I mean, it's just incredible that we have people in leadership who are willing to take these big risks, because I think I was sharing backstage that I see these women every day. They come in my office. Lots of them have suicidal thoughts. Lots of them are actively using substances. Lots of them are in domestic violent relationships. And I think I get a lot of joy because I think I can be one of the first people who validates them in their life, who says, you are worth it. Like, you are normal. Like, your childhood was terrible. What else would you expect from this? And then they leave my office to go back to their abusive relationship, to go back to prison sometimes, to go back to a society that hasn't been structured to provide housing, to provide stable food sources, to provide a way out financially. So many of them have financial abuse where they can't leave, or the court systems use their mental health against them in child custody battles. And so they're prisoners to their relationships because they're not willing to lose their children. And that, I think, we can all make a huge impact on.
Agreed. Thank you, Dr. Coker. I now want to ask the magicians backstage to play a question that we have for Dr. St. John from Rachel Nestor of the University of the West Indies. So hopefully that will magically appear.
My name is Meena Karan. I'm a fourth-year medical student of the University of the West Indies, St. Augustine campus, Trinidad and Tobago. So my question for you all today is, what measures can be taken to prepare health professionals for a changing climate? That is, for health professionals today and tomorrow to be more climate smart. Thank you.
Not from Rachel, but from Meena. And I think that she was asking Dr. St. John, what measures have you taken to prepare health professionals for a changing climate, and how best to care for their patients and themselves, with climate change?
Yes, I understood the Trini accent. So there's first changing the curriculum. So it is part of the curriculum, and it is delivered in a way that they understand, because in the Caribbean, University of the West Indies, we're very clinically minded. So it has to be grounded not just in a patient-doctor interface, but also in the public health way of looking at things, the determinants of health. So you don't just look at a disease-specific way of massaging the topic of climate change and health. So there are changes to the curriculum, not just for the doctors, but also for the nurses. It's a work in progress. It's not perfect. And then within public health itself, it's put into the curriculum of the Masters of Public Health or other allied professionals' curricula. And the other thing that is happening is what I referred to. There's actually a particular course for climate change and health using persons who are already in the Ministry of Health so that they can go back and empower also the regulatory role of the ministries of health. The other thing about climate change and health is that there has to be a change in the way that the daily work life goes on. It's a change of the environment. There's something called smart and green, so that the actual health facilities are not using fluorocarbons in the AC, and that there is a clear adherence to not using plastic if you can't, and other things that make sure that the health institution is not adding to the footprint. And then there is the political empowerment so that people can speak in front of audiences such as these confidently and in a way that people understand that it's not just some esoteric thing that someone is thinking about, but the reason why you're having more severe weather is because of climate change. And then there are specific programs like vector control, something that we do at the Caribbean Public Health Agency. We discovered more than 10 years ago that the life cycle of the mosquito is speeded up because of climate change. And instead of having outbreaks of dengue fever every 10 years, they're now coming every 2-3 years. And so we find ways to not just deliver it to the medical, but also to the other sectors, including the tourism sector. So yes, there has been a lot of change. There's still a lot more to be done. And we are very cognizant of the fact that it is the emitters, not the Caribbean, that is the reason why we're having all of these hurricanes. And we're hoping that in forums such as these in the COP, that there will be some changes, because we're getting it now, but other areas of the world will get devastating impacts of climate change later.
Yes, thank you, Dr. Joy St. John. You talked about an answer to Mina's question. I would say, you said you're focused on ensuring that your students at the University of West Indies and more broadly can speak kind of confidently about climate change in fora like this, and I think she certainly did. So you are clearly already on a very good path for all of us. You spoke about kind of what you're doing for your medical professionals, and I wonder, Alexis, if kind of we can ask kind of what you at Planned Parenthood are doing to support your providers who are now operating under enormous stress, are now being asked to do more than they probably actually were ever trained to do when they were in medical school, are being asked probably by friends, families, and strangers alike to explain what's happening or kind of respond to efforts of either help or targeted harassment. How are your providers, and what are you doing bluntly to better support them in this moment of enormous stress?
Yeah, I mean, we certainly think a lot about the wellness of our providers, not just doctors, nurse practitioners, our frontline staff, everyone who is on the ground answering those calls every day, right? Everybody who's answering that call of hope that's on the other line of someone trying to get the care that they need. So we provide wellness services, for our providers. But the funny thing about the providers, they are warriors themselves. You don't come to Planned Parenthood by accident, right? You come because you are on a mission and you are ready to fight and you are ready to think about all of the ways in which you are going to take that care to the next level. And so in many ways, our providers are already coming to us and saying, we're trying to remind them to take their own time because they want to do more when the injunctions happen. and there's an opportunity to see 10 more patients that week, they are figuring out how to provide the care to the patients. And sometimes that's what they need. They need to be able to provide the care, because that is actually what gives them joy, and that's actually what gives them hope. And so we are, we are always stressing wellness. We are providing call maps. We are doing all the things that one does, and obviously throughout all the work that our local affiliates do. At the end of the day, what we are doing is also seeing them. Right? We are also recognizing them. We are also making sure that they are not just, cogs in a system, that we are elevating them and lifting their voices as providers, because you're right, they become educators. In many cases, they become lawyers, right? They're trying to, at least 2 L's, right? They're trying to figure out all of the crazy regulations that are in the midst of, determining whether or not they will go to jail or experience a $100,000 fine. And so their leadership is so incredible in this organization, really, and it's just been an honor really to serve with them in that way.
Well, it's been an honor for me to be on stage with all of you, and I'm so grateful for all that you have shared with us and all that you are doing. And now, I certainly am going to, with great pleasure, ask each of you to share what more you think we all should be doing to support your work, to support kind of all of our shared purpose to center and elevate and to protect women's voices, votes, and rights. And so, Alexis, I think I'll start with you, and then we'll kind of go down the line, if that's okay.
Sure. So I think there are 2 things. One, I think we have to build an infrastructure around hope. We have, I think sometimes we think of hope as joy, the things that actually give us joy. Hope is really hard. It requires a lot of risk and personal sacrifice and discomfort. And that is what we are seeing all across our movement and all across our healthcare side. We're seeing people put themselves in positions because they understand that every door knock, every call is a call for hope, and they have an opportunity to answer that. And so thinking about how you support the hope of our patients, right? That's abortion funds, that's supporting local independent clinics, that is supporting local Planned Parenthoods. All of those places are incredibly important. How you support hope in the movement is you bring other people into the space. For some of us, it may not be the best thing it may not be supporting a women's rights organization in the moment. It may be asking your corporation what they are doing, right? It may be asking your board of directors, your trustees at your university what you're doing, in order to make sure that we're bringing more people in the conversation that understand that abortion is everyone's business in this moment, that it impacts the workforce, it impacts the consumer, it impacts the economy, it impacts, communities. And really bringing more people into that conversation, I think is helping us build the kind of infrastructure that we need in order to sustain the fight and shorten it so that it doesn't take the next 50 years.
I'm just going to read my call to action. Everyone has a voice. Use your voice, your experience, and your leadership to make sure that no law is passed, no policy is discussed, and no priority is determined without your voice being heard.
So my call to action is for you in this room. Help lift the voices of girls and women in your community to realize a world of equity, inclusion, unity, and action. Create an environment where we are all healthy and free from the effects of climate change.
No pressure. So as I discussed, I think trauma is a thing that we have a lot to work on. The 2 most devastating effects that I see in my daily life of trauma are drug use and suicide. I really appreciate the panel before ours about maternal mortality. And one thing I want to make sure everyone in this room knows that the 2 leading cause of women dying after childbirth is drug use overdoses and suicide. Those are the 2 leading causes that these women are dying. Half of the maternal mortality review committees, we just published a paper about this, do not have mental health representatives on those committees. So I urge anyone here in this room who has a voice in the maternal mortality fight to make sure mental health is represented on those committees so that the legislation is moved forward to help these women.
Well, thank you all for your words, your actions, and for exhorting us to act. Thank you very much. Thank you all.